So good morning. It's my pleasure to present you the results of a phase 3 tourmaline MM1 study, prospective randomized trial comparing Ixazomib, the first oral proteasome inhibitor in combination with Lendex versus Lendex placebo, showing that the triplet, including the Ixazomib, is significantly extending the progression-free survival of patients with relapsed myeloma. This is a study design. Patients were randomized to receive lenalidomide and dex in the standard fashion, conventional dose of lenalidomide, 25 milligrams on days 1 to 21, with weekly dexamethasone plus placebo versus the same combination, Lendex plus Ixazomib, the oral drug, and the flat dose of 4 milligrams on a weekly basis on day 1, 8, and 15 in 28-day cycles. 722 patients were randomized in this double-blind placebo-controlled study. Patients were stratified according to the prior lines of treatment, according to international staging system, and according to previous exposure to proteasome inhibitor or not. The primary endpoint of the study was progression-free survival, with two other key secondary endpoints, overall survival and overall survival in patients harboring 17p deletion. Response were evaluated according to the International Myeloma Working Group criteria and were assessed also by an independent review committee. So the key inclusion criteria of the study, a confirmed diagnosis of myeloma with a measurable disease either in the blood or in the urine or with a free light chain assay, with 1 to 3 prior lines of treatment. All patients were relapsed and or refractory, including primary refractory disease. And the definition of refractory is the usual one, with a progression on treatment or within 60 days after the last dose of therapy. Of note, the creatinine clearance cutoff value for inclusion was 30 milliliter per minute. So this study is representing the real life for our patients, with key inclusion criteria. Patients, of course, refractory to previous proteasome inhibitor treatment or lenalidomide-based treatment. So 722 patients were enrolled in this very large study, very fast, and the two arms are well balanced regarding initial characteristics. You can notice that almost 60% of the patients in both arms of the study did receive one prior line of treatment, and 69 and 70% of the patients, respectively, were exposed previously to proteasome inhibitors. So this is the primary endpoint of the study, progression-free survival, with a final analysis showing a 35% improvement in PFS with a median follow-up of 15 months. You can see that the Ixa-Lendex arm is reaching 20.6 months median PFS versus 14.7 months in the placebo arm, so a difference of 6 months that is clinically relevant, with the p-value of 0.01 according to the log-rank test and a hazard ratio of 0.74. So a response rate was also increased in the Ixa-Lendex arm, not only the overall response rate, but also the very good partial response rate, or better, 48% versus 39%. The response were very quick with the triplet combination, with a median time to response of 1.1 month. The median duration of response was significantly increased, and the median time to progression was also significantly increased in the Ixa arm, 21.4 versus 15.7 months. When looking at the toxicity of the triplet combination, you can immediately notice that versus placebo, really few grade 3 and 4 toxicity, so no GI toxicity with Ixazomib. Rash was not an issue with Ixazomib. You know that in phase 1 we had some concerns regarding rash, but in combination with dexamethasone, we have only 5% of grade 3 and no grade 4 rash. you can notice a higher number of thrombocytopenia in the Ixa arm, 12 grade 3 versus 5% grade 3 in the placebo arm, but did not impact the number of transfusion and not impact the number of severe bleedings as well. Of note, no peripheral neuropathy with this oral proteasome inhibitor, so this is a very important point as well, and no increased incidence of deep vein thrombosis when adding Ixa to Lendex. So a very safe profile of the triplet combination, including Ixazomib. So the conclusion here, and this is my last slide, Ixazomib, when combined with Lendex in patients with refractory myeloma, was associated with a significant and meaningful improvement in progression-free survival, improved time to progression and response rate as well. I'm going to present tomorrow the results in high-risk patients, poor cytogenetics, and the benefit is identical, and the group of patients with high-risk cytogenetics is enjoying exactly the same PFS of patients with standard risk cytogenetics, and this is a very important point to be kept in mind. Ixazomib is adding limited toxicity to lenalidomide and dex, with a very low rate of peripheral neuropathy and no cardiovascular or renal adverse signals. And this all-oral triplet regimen may become one of the new standard of care in the relapse setting with a very safe profile, very effective combination, simple and convenient. So Ixazomib was approved by the US FDA on November the 20th under the name Ninlaro.